The title of my talk is ΓΝΩΘΙ Σ'ΑΥΤΟΝ, which of course means know thyself in ancient Greek. It's essential for, I think, for living a good life. Psychology, however, from Freud to modern neuroscience, has demonstrated how difficult a task that is. It has been shown that such knowledge is at best tentative and incomplete. Indeed, science, like Buddhism, has called into question the very notion of a unified self. Now, while there are a host of reasons for our limited self-awareness, a significant factor for many people is the psychological damage that was done to them in their early years. Primal therapy, has developed over 4 decades by Dr. Arthur Janov, explores those early dynamics and the effects on children. Now, I should stress that this is not primal scream therapy. That was just the title of a book. It has nothing to do with screaming. I will briefly touch on some of the similarities with other psychodynamic therapies, and then stress that in order to truly know oneself, we have to know more than just ourselves. We need to know something about our society, political economy, anthropology, culture, and so on. So much to cover, okay. One of the key concepts behind primal therapy is that the ability to feel is essential to being human and to being alive. Another key concept, and Anna talked about this a little bit earlier as well, is the concept of inside-outside. In other words, that we constantly internalize what's around us, whether it's our environment, whether it's other people, whether it's noise. It becomes part of us. It physically changes our brains. This is especially true because of what are known as mirror neurons, recently discovered neurons which are the basis, apparently, for empathy, not only in human beings, but other primates as well. Now, what's really interesting, I think, is that in the last few years, a paradigm shift has been happening. People are discovering that the events and the environment surrounding preconception, pregnancy, birth, and early infancy are the template that in which we live our lives. For example, by the 6th prenatal month, most of the 100 billion neurons found in the adult brain are already existing in the brain of the fetus. It's been clearly demonstrated, and this shouldn't surprise anyone, that adverse effects on the mother when she's pregnant are going to have potentially a huge effect on her child. Whether, again, it's stress, whether it's pollution, lack of good nutrition. Cohen-Lubach found, for example, that it is not only that babies react to the state of the mother and to salient environmental events while still in the uterus. This stimulation and priming seems to be essential for guiding the optimal maturation of the nervous, endocrine, and immune systems. So, of course, if the conditions are not optimal, then we grow up essentially imprinted with less than optimal immune systems, for example, endocrine systems. So first we need a good environment as we're developing in the womb. Secondly, we need a safe and gentle birth. If we don't get it, that can be also remembered physically within the body. As Anand and Scalzo report, neonatal complications such as forceps delivery were, quote, significantly correlated with adult suicides in males later on in life. And a lot of what happens in our early life is only manifested later on. Another element is what Janov terms sympathetic and parasympathetic conditions. The way Bowlby describes it is the infant can respond in the absence of proper attachment with a protest phase, where you get highly activated, your fight or flight responses kick in as you struggle to get the maternal or paternal attention you need. If it doesn't happen, you tend to shut down, a parasympathetic form of behavior, which again can carry on throughout a person's life. So someone like me spent a lot of time struggling with everything. If there was a challenge where some people just give up, some of us see it as the only way we can basically survive is to keep struggling as long as we can. It's not healthy necessarily. Martha Stout at Harvard writes about this very important concept, dissociation. Dissociation is a universal condition when a child or an adult is in a situation that is so overwhelming, they cannot cope with it, they cannot consistently struggle with it, so they have to shut down. It's a survival mechanism. The problem, especially with children, is that long after the ordeal is over, the tendency to be disconnected, your feelings from your consciousness, persist. In fact, Robert Sapolsky recounts a study in an orphanage where babies were taken care of. They were fed, they were changed, they were not talked to, they were not held, and in 9 out of 10 such orphanages, every single baby died. The main reason, and again, I'm oversimplifying, but the main reason is because their bodies were essentially freaking out, their immune systems were compromised because of stress, hypercortisol levels, and so on, and they died from simple things that a healthy child could fight off. I'm going to jump way ahead here because we're just almost out of time, and I want to leave some time for discussion as well. As Paul Brenner put it, our parents' unmet needs become our unmet needs. The sins of the parents are passed on to the children. The essence of primal therapy, and I'm just going to actually skip my notes now. The essence of primal therapy is that in order to heal, what a patient has to do many times, it's not the only effective therapy, but Janov considers it essential, is you actually have to open up and face all of the repressed pains that go back, maybe to the womb, to childbirth, to early infancy, and so on. And of course, pains can continue to be inflicted throughout your entire life. But the idea is that, and this is where ΓΝΩΘΙ Σ'ΑΥΤΟΝ comes in. If you can, in the proper situation with the proper support, go back and face the pain that was too great when you were little, and you face it in small doses as an adult with support and a supportive environment, a safe place, what you maybe didn't have when you were a child, then bit by bit you can start to heal. Janov calls this neurosis in reverse, where you start usually with what's happening at the moment. I'm upset because of my job or my spouse or whatever. And the question is, where does that feeling come from? And you go back. And over time, if you have good therapy, you go back to the earliest kinds of hurts. And Janov argues it's that connection between affect and consciousness that can be healing. Again, we're not talking about a complete cure. And we're not talking about that there aren't other modes of therapy that are effective. But his difference with some other kinds of psychodynamic therapy, especially, is that for whatever reasons, a lot of times therapists will not let the patient go as far back as they need to. I should mention one other, among many things. There's an important distinction between implicit and explicit memory. Explicit memory are the things that we can just remember what happened last year or last decade ago. That usually begins no earlier than when you're 2 years old. Almost nobody can remember consciously what happened to them before they were 2 years old. Explicit memory is how your body was shaped by the experiences, and your body remembers. Your central nervous system is imprinted, it's affected. The set points for, say, cortisol levels, for blood pressure are set at a level that's not correct when you're little, and your body essentially remembers that. And in primal therapy, the idea is eventually you go back to those things where you don't really remember them, but your body is making that connection. And it's the connection, Janov says, is its healing. And one of the most amazing things is you might be mystified about why you did something. If you can connect with the old feeling, why, say you got angry when somebody just made a comment that was trivial, but you overreacted. If you can get back to that and you experience it, then you say, that's why I got so upset. That's why I'm impatient with my kids. And the important point that Janov stresses is that thoughts follow feelings. First, you have, most of the time, you make that emotional connection, and then you understand. That's why I did that. That's why I've always been impatient, whatever. I think I'm out of time. Anyway, thank you very much.